Hello friends, let us now learn some important points about the dilated cardiomyopathy from Robbins. Dilated cardiomyopathy is morphologically and physiologically and functionally it is characterized by dilatation of heart and contractile dysfunction. So this dilated cardiomyopathy, so here heart is dilated, heart muscle is dilated, right? So this cardiomyopathy, heart is dilated and as a result it is poorly contractile. We have familial types of the dilated cardiomyopathy. First, if we see the etiology, it can be due to genetic or familial causes. It can be either genetic causes or familial causes or other toxins. So first, if we see genetic influences, almost 30 to 50% are familial cases, and in the familial cases it occurs due to the mutations in more than 20 different genes which are encoding different proteins which are involved in cytoskeleton, sarcolemma or nuclear envelope. In all those, the most important protein is titin mutation. This titin is actually the largest protein which is expressed in humans. So mutation of this titin protein is one of the most important causes, and this accounts for almost 20% of dilated cardiomyopathy. In genetic forms of dilated cardiomyopathy, this autosomal dominant pattern is predominant, and this autosomal dominant pattern is associated with this titin mutation. Sometimes X-linked type of dilated cardiomyopathy is also seen, which is associated with this protein dystrophin, and as a result it is associated with Duchenne's muscular dystrophy. Right now, even mitochondrial inheritances are also seen, but they are less common. In the mitochondrial, in some families, there occurs deletions of mitochondrial genes occurs, which will affect oxidative phosphorylation and mutation of enzymes which are involved in beta oxidation of fatty acids. So these mitochondrial defects are most commonly seen in children or pediatric age group. So, and there is X-linked dilated cardiomyopathy, which I have said, that is X-linked recessive dilated cardiomyopathy, which is associated with this dystrophin protein, mainly occurs in puberty or in early adulthood. This is associated with the mutations which are affecting the membrane associated dystrophin protein. Okay, so this is mainly due to the mutations in membrane associated dystrophin protein, which couples cytoskeleton in the extracellular matrix. So this dystrophin protein mutations is mainly seen in Duchenne's muscular dystrophy. Right, so it is associated with Duchenne's muscular dystrophy. Then this dilated cardiomyopathy is also associated with this myocarditis. So in the myocarditis especially, it is associated some viral causes of myocarditis like Coxsackie B virus or other viruses. In those viruses, dilated cardiomyopathy is seen. Then toxins, if you see, alcohol is one of the important toxin, and it is alcohol abuse is strongly associated with the development of dilated cardiomyopathy. And this alcohol abuse, it is associated with ethanol toxicity, which is associated with dilated cardiomyopathy. Sometimes this alcohol along with the malnutrition and any nutritional disturbances can also be associated with this dilated cardiomyopathy. Chronic alcoholism. This chronic alcoholism can be associated with beriberi or vitamin B1, that is vitamin B1 deficiency. In the beriberi, we have a type of wet beriberi where there is heart symptoms, heart involvement is seen. In the wet beriberi also, you will see dilated cardiomyopathy. That type of dilated cardiomyopathy can be called as alcoholic cardiomyopathy, as you will not see lots of differences morphologically between the alcoholic cardiomyopathy and dilated cardiomyopathy. This dilated cardiomyopathy will later lead to myocardial failure also. Next, in the toxin, the second important toxin is anthracycline. This anthracycline and also doxorubicin. Okay, this doxorubicin or adriamycin is one more chemical agent. This chemical agent is an important cause of dilated cardiomyopathy. Cobalt is also one of the important mineral, heavy metal involved in dilated cardiomyopathy. Then peripartum or in childbirth. If you see this, in the peripartum or in the childbirth, the type of cardiomyopathy which occurs in late pregnancy, that is in third trimester, or in postpartum for some months, that is called as peripartum cardiomyopathy. The mechanism of action of this peripartum cardiomyopathy is poorly understood and it is multifactorial. But this pregnancy associated hypertension, volume overload, nutritional deficiencies and metabolic derangements, all these will form a particular one important thing which will affect the cardiomyopathy which is seen in pregnancy. There are some proangiogenic things, especially prolactin. Even prolactin is also found to be necessary or important in dilated cardiomyopathy. Then if you see in the dilated cardiomyopathy, one more thing is hemochromatosis or iron overload. This hemochromatosis or iron overload is associated with both dilated cardiomyopathy or restrictive cardiomyopathy, but this is the most common manifestation of dilated cardiomyopathy. Then you have one more thing which is called as these are the important types of dilated cardiomyopathy, right, causes. Now if you see in the heart, morphologically the heart is usually enlarged, it is heavy and flabby, and this occurs due to the dilatation of all the chambers of the heart. Here you will see dilatation of all the chambers of the heart. Because there is dilatation of all the chambers of the heart, these valves will also get dilated, especially the mitral valve and tricuspid valve will also get dilated, and that will result in regurgitation anomalies can occur secondarily due to this dilated cardiomyopathy. As a result, this results in both mitral regurgitation and tricuspid regurgitation may be present, right. So histologically you will see that the muscle cells are hypertrophied with enlarged nuclei, and you will see the dilated muscle fibers also. So if you see the clinical features here, this mainly occurs between the age group of, this is seen mainly between the age group of 20 to 50 years of age, though it occurs also in childhood. This is slowly progressive symptoms are seen like dyspnea, fatigue, poor exercise capacity are seen, and in the end stage this leads to decreased ejection fraction. Sometimes this ejection fraction is typically less than 25%, especially in end stage disease. Here you will see mitral regurgitation, and you will also see some of the clinical features of mitral regurgitation also. So here the death in this case, the death usually occurs due to the progressive congestive heart failure or cardiac failure or arrhythmia, or it can also occur, sudden death can occur. The annual mortality is seen in almost 10 to 50% of cases. And here cardiac transplantation is the only treatment which is available for this dilated cardiomyopathy. Thank you for watching.